ever thought of nursing as your occupation? Taking care of the elderly, playing with children, consoling the sick person, being there for someone when they're on their deathbed. These are some of the things that you would do being a nurse. The bond that builds up between the patient and his caretaker, the nurse, is something to be cherished. The patient becomes dependent on you, and as long as he is under your care, you become his guardian angel. Many people also go for nursing as their second career. To become a qualified nurse, you have to take nursing education from any recognized nursing school or nursing college. Nurse education is just like any other education, where you would be taught and prepared for nursing care. The students will be given lessons on various health education and medicines by qualified doctors, experienced nurses, and educators. Almost everywhere around the world the basic courses are similar, like general nursing, mental health nursing, and taking care of sick children. The courses are usually 3 years long. Nursing is taught in nursing schools. You can also get a postgraduate qualification in any specialist subject within nursing from a reputed nursing college. In the past, the emphasis was more only on the practical part, but now all nursing schools are focused both on the theoretical as well as the practical part, as nurses have to deal with so many types of patients. They have to know what to do and what not to, in case the doctor is not around. They are given basic education on medicine as well. Nurses today are not just a helper of the doctor concerned, but they are trained so that they would be able to contribute equally to the team. Nursing education. The first nursing school was set by Florence Nightingale at St. Thomas Hospital, London. The curriculum in those days was just focused on hygienic factor and task competence. Nursing at that time was mainly adopted by girls, often taken in religious orders. But now we find many male nurses in all the hospitals, especially in mental health services. So many nursing schools and colleges have come up with the increasing need of nurses all over the world. It is recorded that in America itself there are about 45,000 nursing schools. A lot of arguments still surround nursing education. Some believe that practical knowledge is what is most important, but some argue that with so many advancements coming in the medical world, these nursing schools should be able to teach them to manage healthcare and also to see the future picture. So to meet all these needs, nursing schools aim to train nurses who can be nurtured and trained to be lifelong learners, so as to meet any changes in both theory and practical parts of nursing. Things to remember. There are some points that you should remember when going for a nursing education. Decide on what program you want to take, and then decide on a school that matches. Look out for the featured schools around your area. Some people want the close attention of a small school, while others prefer the intellectual stimulation of a large institution. So make inquiries about the school, and the school's reputation. So it is better to take a school where the ratio of the students and the faculty is good. It is better to be in a small class size so that each student will be given equal attention. See that the school meets the standards of education set by a national accrediting organization. To become a nurse you would need to dedicate your time and care whenever there is a need. Remember, you can be a nurse at any age. If you are in your 30s or 40s, this doesn't mean you are not eligible. As long as you are ready to dedicate your life into this profession, you can become a nurse.